If you find your pet collapsed, shaking, staring into space, and non-responsive, it may be that they're having a seizure, or what we call a fit. Pets may have full seizures, during which time they appear non-responsive, shake, and may froth at the mouth. But they can also have milder seizures, where only part of their body shakes and they're still conscious. Animals often become distant or spacey after a seizure, and sometimes this is the only thing that lets you know that something's happened. If you find your pet having a seizure, turn the lights off and reduce noise, which may heighten the seizure and cause additional stress. Move away any objects from your pet, including furniture, which they may injure themselves on. You should also time the frequency and duration of the seizures. Because prolonged seizures may result in overheating, it may be appropriate to place a damp towel in order to facilitate cooling. If your pet has a history of seizures, you may want to administer any medication according to your veterinarian's instructions. At the end of the seizure, keep your pet nice and warm and in a quiet place, and call your veterinarian. Now, I'm not going to ask Delilah to demonstrate this part, but if you find your pet making choking sounds, taking large or irregular breaths, making gasping head extensions, or if they have a blue-tinged tongue or lips, it could be that they're choking. As always, handle your pet carefully, as distressed animals can bite. If possible, you should have someone else call your veterinarian and be the designated driver while you attend to your pet's needs. If your pet can still breathe, you should take it to the veterinarian immediately. But if your pet is not breathing, Delilah and I have recorded some steps for you to follow. Open the airway by gently grasping the tongue and pulling it forward out of the mouth until it is flat. Quickly examine inside the mouth for any objects. If the object is in easy reach, attempt to remove it using your hands, pliers, or tweezers. Be careful not to lodge the object further down the throat, and don't spend too much time attempting to remove it. It's more important that you seek veterinary attention as soon as possible. If a foreign object is identified but too difficult to remove, lay your pet on their side and slap the side of their ribcage firmly with a closed hand 5 times. The aim is to force air from the lungs and attempt to move the object. Repeat during your journey to the veterinarian or until the object dislodges. Perform rescue breathing every 5 seconds by holding your pet's mouth closed with your hand and breathing directly into their nose until you see their chest expand. Once the chest is expanded, continue rescue breathing every 4 or 5 seconds. But just watch out for those licks, Delilah. Next, we're going to talk about collapse and shock. Symptoms of shock can include panting, a lack of heartbeat, bleeding from the nose, mouth, or rectum, pale gums, and weak or rapid pulses. You should first check for any obvious signs of bleeding or trauma, for the presence of breathing, as seen by rising and falling of the chest, and the presence of a heartbeat. The heart's located in the lower half of the chest on the left-hand side, just behind the elbow of the front leg. If you don't feel a heartbeat, there's unfortunately a very low chance of your pet surviving from resuscitation efforts. However, in an emergency, it may be the only chance your pet has. Don't begin chest compressions until you've secured an airway and started rescue breathing, as we discussed previously. Gently lay your pet on their right side on a firm surface. For medium-sized dogs, press down gently over their heart at about a depth of 1 inch. Press harder for larger animals, and for smaller animals you should use less force. You can use 2 hands for medium and larger sized dogs, but for smaller dogs I recommend placing 1 hand underneath their chest for support and then pumping with the other hand over the heart. To massage the hearts of cats and other tiny pets, cradle your hand around the animal's chest so your thumb is on the left side of their chest and your fingers are on the right side, and compress the heart by squeezing it between your thumbs and fingers.